talk now a little bit about the concussion recovery. So why craniosacral therapy can be an important piece in recovery?
I think that craniosacral therapy is the perfect tool to add into concussion recovery. And I'll talk a little bit about the research in a minute, but what I really want to emphasize is that it is not the only tool to use. I always say, and in the articles I've written, it's a piece that's missing. So craniosacral therapy, for those listeners that may not know about it, worth reading about, it's a really gentle, non-invasive manual therapy, and it involves lots of different systems, but primarily what we call the craniosacral system, which is a dura that aligns cranial bones and creates a system of CSF flow in a very simplistic way of describing it, but it has huge interconnections and influence on everything else. So when we talk about practicing craniosacral therapy, it is not simply just working with one small area, at least the way I approach it. I approach the whole body. So that's the bottom line. And it allows us to kind of creep underneath the radar. So if you're working with a concussed population, many of you might have seen this, and if you haven't, I want you to look for it, but often it feels like a sensor integration issue. So their sympathetic nervous system is working way up high. It's not in balance with parasympathetics. It doesn't take much to put them over the edge. They're already many times struggling both with visual vestibular issues, and we look at cervicogenic issues as well. The physiology is something we have to pay attention to. Craniosacral therapy helps modulate. One of the things it does really well, modulate the sympathetic system and drop it down to a manageable level, so that any of the techniques that you're going to apply, any of the things that we need to apply, it really takes a team approach in concussion recovery, are much more able to be managed by the patient. It doesn't spin the patient into overwhelm. They want to come back and get the therapies because they're actually able to manage the therapies. So it's huge for that. That being said, there's information coming out now that we sense with our hands about the influence of the CSF and the need for CSF to actually be able to move byproducts out of the brain and tissue. So there's research done by Nedergaard, some of you might have heard of that, on glymphatics. If you haven't, well worth getting information on. That system that's throughout the brain that has to move CSF. So if we don't move CSF, and if the areas of the pathways that it moves out aren't mobile, if there's any kind of distortion in them, then we actually either get a backup or we have byproducts that don't get moved that are detrimental to the brain. So everybody knows about amyloid beta, that's one of them, but there's many other caustic products that are developed. So the idea of craniosacral therapy, and they've documented this, changes some of the fluid flow. And I'll give you an example that is not as much about glymphatics, but it is about some of the bony structures. So if you look at the facial sutures, for example, the suture at the nasal frontal bone, and if you look at the ethmoid bone and the vomer as it articulates with the sphenoid, all of that has to be mobile. If you look at someone who's been concussed, particularly in our population that we were studying, which are NFL players, a lot of helmet blows, a lot of head blows, a lot of facial trauma, a lot of trauma communicated up to the head and face. If those areas don't move, particularly the area through the middle of the eyes, right around the ethmoid, some of the figures say 70% of CSF flow has to move through there. If it doesn't move through there, it doesn't move through there. The deep cleansing of the brain doesn't occur. And that's very, very important. A lot of these guys don't sleep, right? They're getting 2 hours of sleep at night. When we sleep, our brain cells actually shrink so that the CSF can go around them and do the deep cleansing. Critical part. So the neurodegenerative diseases that we see, some people feel that most of them are from a lack of brain cleansing. You certainly see it in the NFL population.